In this video we will learn about pituitary gland, and following details about pituitary gland. Pituitary gland is master gland, posterior pituitary gland, PPG, anterior pituitary gland, APG, overproduction of pituitary hormones, underproduction of pituitary hormones. Definition of endocrine organs. An organ that makes hormones that are released directly into the blood and travel to tissues and organs all over the body. Endocrine glands help control many body functions, including growth and development, metabolism, and fertility. Some examples of endocrine glands are the pituitary, thyroid, and adrenal glands, and the diagram shows different endocrine organs. Definition of hormones. Hormones are chemicals that coordinate different functions in your body by carrying messages through your blood to your organs, skin, muscles and other tissues. These signals tell your body what to do and when to do it. This diagram shows different organs producing different hormones. The pituitary is a pea-sized gland that is housed within a bony structure, sella turcica, at the base of the brain. The sella turcica protects the pituitary but allows very little room for expansion, as shown in diagram. Pituitary gland is master gland. The pituitary controls the function of most other endocrine glands and is therefore sometimes called the master gland. In turn, the pituitary is controlled in large part by the hypothalamus, a region of the brain that lies just above the pituitary. By detecting the levels of hormones produced by glands under the pituitary's control, target glands, the hypothalamus or the pituitary can determine how much stimulation the target glands need. Location of pituitary gland. The pituitary gland is no larger than a pea, and is located at the base of the brain. The gland is attached to the hypothalamus, a part of the brain that affects the pituitary gland by nerve fibers and blood vessels. Types of pituitary gland. Your pituitary gland is divided into two main sections, the front, anterior, lobe and the back posterior lobe. 1. The anterior pituitary gland. 2. The posterior pituitary gland. Difference between posterior pituitary gland and anterior pituitary gland. Posterior pituitary gland doesn't produce their own hormones, only store hormones, release hormones upon stimulation. Anterior pituitary gland produce their own hormones, release hormones upon stimulation. Location of posterior pituitary gland. PPG. It lies in the sella turcica in the sphenoid. It is inferior to the hypothalamus and connected by the infundibulum. Hormones of hypothalamus release in posterior pituitary hormones. Posterior pituitary hormones produced in hypothalamus. PPG only stores and releases hormones upon stimulation. 1. Vasopressin to oxytocin. PPG controls all other endocrine glands. Target organs of posterior pituitary gland hormones. Vasopressin target organ is epithelium of distal nephron, and oxytocin target organ is uterus and cervix. Function of posterior pituitary gland hormones. Vasopressin function is to act on nephron to conserve water. Oxytocin function is to contract uterus and cervix during labor, role in lactation. Location of anterior pituitary gland. It lies in the sella turcica in the sphenoid. It is inferior to the hypothalamus and connected by the infundibulum. Hormones of hypothalamus to trigger anterior pituitary gland. Hypothalamus releases thyrotropin-releasing hormone, TRH. Hypothalamus releases corticotropin-releasing hormone, CRH. Hypothalamus releases gonadotropin-releasing hormone, GnRH. Hypothalamus releases growth hormone-releasing hormone, GHRH. Hypothalamus releases dopamine inhibitor. Hormones of anterior pituitary gland. 1. Hypothalamus releases thyrotropin-releasing hormone, TRH, and triggers anterior pituitary gland. Then, anterior pituitary gland releases thyroid-stimulating hormone TSH. 2. Hypothalamus releases corticotropin-releasing hormone, CRH, and triggers anterior pituitary gland. Then, anterior pituitary gland releases adrenocorticotropic hormone, ACTH. 3. Hypothalamus releases gonadotropin-releasing hormone, GnRH, and triggers anterior pituitary gland. Then, anterior pituitary gland releases follicle-stimulating hormone, FSH, luteinizing hormone, LH. 4. Hypothalamus releases growth hormone-releasing hormone, GHRH, and triggers anterior pituitary gland. N. Anterior pituitary gland releases growth hormone, GH, somatotropin. 5. Hypothalamus releases dopamine inhibitor and triggers anterior pituitary gland. Then, anterior pituitary gland releases prolactin. Target organs of anterior pituitary gland hormones. 1. Hypothalamus releases thyrotrophin-releasing hormone, TRH, and triggers anterior pituitary gland. Then, anterior pituitary gland releases thyroid-stimulating hormone TSH, and its target organ is thyroid. 2. Hypothalamus releases corticotropin-releasing hormone, CRH, and triggers anterior pituitary gland. Then, anterior pituitary gland releases adrenocorticotropic hormone, ACTH, and its target organ is adrenal cortex. 3. Hypothalamus releases gonadotropin-releasing hormone, GnRH, and triggers anterior pituitary gland. Then, anterior pituitary gland releases follicle-stimulating hormone, FSH, luteinizing hormone, LH, and its target organ is gonets. 4. Hypothalamus releases growth hormone-releasing hormone, GHRH, and triggers anterior pituitary gland. Then, anterior pituitary gland releases growth hormone, GH, somatotropin, and its target organ is liver, muscle, kidney, bone. 5. Hypothalamus releases dopamine inhibitor and triggers anterior pituitary gland. Then, anterior pituitary gland releases prolactin and its target organ is breast. Function of anterior pituitary gland hormones. 1. Thyroid-stimulating hormone, which stimulates the thyroid gland to produce thyroid hormones. 2. Adrenocorticotropic hormone, ACTH, also called corticotropin, which stimulates the adrenal glands to produce cortisol and other hormones. 3. Follicle-stimulating hormone and luteinizing hormone, the gonadotropins, which stimulate the testes to produce sperm, the ovaries to produce eggs, and the sex organs to produce sex hormones, testosterone and estrogen. Function of anterior pituitary gland hormones. 4. Growth hormone, which regulates growth and physical development and has important effects on body shape by stimulating muscle formation and reducing fat tissue. 5. Prolactin, which stimulates the mammary glands of the breasts to produce milk. The pituitary gland can malfunction in several ways, usually as a result of developing a non-cancerous tumor adenoma. The tumor may overproduce one or more pituitary hormones, or the tumor may press on the normal pituitary cells, causing underproduction of one or more pituitary hormones. The tumor may also cause enlargement of the pituitary gland, with or without disturbing hormone production. Sometimes there is overproduction of one hormone by a pituitary tumor and underproduction of another at the same time due to pressure. Overproduction of pituitary hormones. Overproduction of pituitary hormones causes disorders, including acromegaly or gigantism, Cushing disease, Galactorrhea, erectile dysfunction, infertility. Acromegaly or gigantism. Definition: overproduction of growth hormone causes excessive growth. In children, the condition is called gigantism. In adults, it is called acromegaly. Symptoms: Gigantism symptoms: abnormally tall stature, abnormal growth of the face, hands and feet, thickened facial features, irregular menstrual cycle, excessive perspiration with slight activity, delayed puberty. Acromegaly or gigantism. Diagnosis: blood tests, imaging tests, CT or MRI. The diagnosis is confirmed by blood tests, which usually show high levels of both growth hormone and insulin-like growth factor 1, IGF-1. Treatment: surgery, radiation therapy, drug therapy. Stopping or reducing the overproduction of growth hormone is not easy. Doctors may need to use a combination of surgery, radiation therapy, and drug therapy. This diagram shows acromegaly or gigantism. Cushing disease. Definition: in Cushing syndrome, the level of corticosteroids is excessive, usually due to taking corticosteroid drugs or overproduction by the adrenal glands. Cushing disease. Symptoms: red and round face, obesity, osteoporosis, muscle wasting, CNS irritability, emotional disturbance, hypertension, cardiac hypertrophy, hyperplasia, tumor, purple striae, skin ulcers. Cushing disease. Diagnosis: measure the level of cortisol in the urine, saliva, and/or blood, sometimes other blood and imaging tests. Treatment: diet high in protein and potassium, drugs that decrease cortisol levels or block the effects of cortisol, surgery or radiation therapy. Treatment depends on whether the problem is in the adrenal glands, the pituitary gland, or elsewhere. Galactorrhea. Definition: Galactorrhea is the production of breast milk in men or in women who are not breastfeeding. Symptoms: persistent or intermittent milky nipple discharge involving multiple milk ducts, spontaneously leaked or manually expressed nipple discharge, one or both breasts affected, absent or irregular menstrual periods, headaches or vision problems. Galactorrhea. Diagnosis: measurement of blood prolactin level, computed tomography or magnetic resonance imaging. Treatment: drugs to block prolactin production, sometimes surgery or radiation therapy. Drugs can be given that mimic dopamine, the chemical in the brain that blocks prolactin production. They include bromocriptine and cabergoline. Underproduction of pituitary hormones, central diabetes insipidus, hypopituitarism. Learn terminologies with MJM.